How do our lungs work, and how do they develop? Our lungs and airways look a bit like an upside-down tree. Like the trunk, the windpipe splits into two large airways, one for each lung. And just like branches, the airways split further into smaller and smaller tubes. The tubes end in bunches of small sacs called alveoli, like leaves on our tree. These alveoli are where the blood meets the air in the lungs and oxygen gets into our bloodstream, while carbon dioxide is removed to be breathed out. Having this tree-like structure means the surface of our lungs is as large as possible, so more oxygen can get into our blood. The walls of the alveoli sacs are covered in a substance called surfactant. This keeps them from collapsing when air moves in and out. Our lungs continue developing more alveoli until early adulthood. In premature babies, the airway tree has not fully grown yet. While the big airways are present, the smaller airways still need to develop. The alveoli are more like buds rather than leaves. These buds are often not yet able to make enough surfactant. So, premature babies have a smaller surface area to take in oxygen and remove carbon dioxide, and it is also harder for them to keep their alveoli open. In addition to this, preterm babies' rib cage is not as stiff and their muscles are not as developed as term or older babies. This can also make opening their lungs and keeping them open difficult. Steroids are important in stimulating lung development. This is why sometimes doctors will prescribe steroids before birth if they think a baby might be born early. After babies are born, several types of respiratory support and medications, including surfactant, are available to help them while their lungs are developing. How are apneas treated? It may feel scary when your baby has an apnea. Other parents feel this way too. Your baby's nurses and doctors are used to looking after a baby during an apnea and will be able to help them. Sometimes apneas can stop by themselves. Other times, all your baby will need is a gentle stimulation, like a reminder to breathe. We do this by speaking to them or softly rubbing their chest or back. Other times, they may need extra oxygen, or the clinical team may need to give some additional breathing support on a temporary basis. If apneas are more frequent, a ventilator machine can be used to take over their breathing to give their lungs and brain time to grow and develop. Babies can also be given medication, like caffeine. Research has shown that caffeine reduces the number of apneas babies have. Most babies born before 32 weeks gestation will be given caffeine to help with their breathing. Occasionally, babies may also be given other medication, like Doxapram. All babies are different. There is no one-size-fits-all treatment or point at which treatment should be stopped. Your clinical care team will tell you which treatments might be helpful to your baby. Methods of respiratory support. Preterm babies have a number of reasons why breathing can be difficult. They do not always get regular messages to breathe from their brain. They also have soft chest walls and small breathing muscles. This makes it more challenging for them to open their lungs. Each baby is different. There are a number of different ways to support a baby's breathing and make it easier for them. Your medical team will choose the best support to suit your baby. This may mean changing between methods of respiratory support. There are different machines that can be used to support your baby's breathing. A ventilator can be used to completely take over a baby's breathing. A breathing tube is placed in the baby's airway to deliver air and oxygen to the baby's lungs. Babies are sometimes given medication, like morphine, whilst they are ventilated, to make them more comfortable. If babies can breathe on their own but need extra support to keep their lungs open, CPAP or high-flow therapy can be used. CPAP stands for Continuous Positive Airway Pressure. A mask over the baby's nose or some prongs in the nose are used to give air and oxygen to make breathing easier for them. High-flow therapy uses small plastic prongs which sit just inside the baby's nose. With CPAP and high-flow therapy, the air is warm and humidified, and the level of oxygen and breathing support a baby receives can be varied. This might be done by the baby's nurse. Some machines can automatically adjust oxygen levels based on the oxygen saturation of the baby. Low-flow oxygen therapy provides oxygen to the baby through tubes just inside their nose at a lower flow rate than high-flow, and the air is not warmed and humidified. There is not a single order in which babies receive respiratory support. Every baby's journey through the newborn care unit is different. Sometimes babies will still need oxygen when they are ready to go home from the hospital. If this is the case, you will be supported in hospital, before you leave, and at home with regular visits from the nursing team. How does the brain work? The brain and our nervous systems are made up of lots of cells called neurons. Different parts of the brain do different things. For instance, the back of the brain helps us to see, and the top of the brain is where we process touch. The neurons are constantly communicating with each other by sending electrical signals. The electrical signals sent by neurons also allow us to respond to the outside world. For instance, when someone touches your hand, this is detected by neurons in your skin. These neurons then send a message to the touch area of the brain so that you know that you have been touched. At the same time, neurons in the visual area of your brain communicate with neurons in the touch area so that you understand that the person you can see is also the person that is touching your hand. Brain development. In premature babies, the brain is still developing. In fact, brain development starts before birth and continues into adulthood. But for premature babies, the brain is developing very rapidly. We can see how much the brain is changing simply by looking at its size and shape. At 22 weeks gestation, the brain is about as big as a tangerine. Its surface is smooth. As babies grow, the brain gets larger, and the surface starts folding to create the ridges and grooves we are used to seeing in pictures of the brain. We can visualize this by thinking that the brain looks a bit like a coffee bean at 22 weeks gestation, and then develops to looking more like a walnut. The ridges and grooves give the brain a larger surface, allowing more neurons to fit in. At 28 weeks, the brain is the size of an orange, and at term age, the brain is the size of a small melon. An adult brain is twice as large, so there is still a way to go.